Good morning. My name's Suleika Jaouad, and I am a cancer survivor. Uh, I'm also a journalist and wrote the New York Times column and video series Life Interrupted, where I chronicled what it was like to live with cancer for the better half of my 20s. The name of my column was Life Interrupted because that's what it feels like to be a young person and to get cancer. It's an interruption of everything you knew before. At the time, I was 22 years old and my adult life was just beginning. Less than a year after walking across the stage at my college graduation, my doctor sat me down and uttered those 3 words you never want to hear. You have cancer. During the 3.5 years I spent in treatment, my insurance covered nearly $3 million in medical expenses, including the transplant, the chemo, the clinical trial, and over 20 emergency hospitalizations, amounting to a combined 8 months of inpatient care. It all sounds pretty straightforward when I explain it like that, but even if you have good health insurance, like I did, the cost of healthcare in dollars, as well as in time and stress, is still incredibly overwhelming. Every time I saw a doctor, got a CT scan, received chemo, or picked up a prescription, insurance covered only part of that transaction, and there was always a bill on top of it. For a patient like me who took over 30 pills every day and visited the hospital on a weekly basis, and that's if things were going well, I seemed to owe another payment each time I blinked. Keeping track of how much I owed and for what procedure and why still makes my head spin just thinking about it. Learning the ins and outs of an insurance plan's coverage takes sustained, persistent attention and energy, things that sick people have in short supply. Another cost of my cancer care was time. My mom graciously took on the task of disputing claims, keeping track of bills, requesting approval for a procedure or a drug, and spending countless hours on the phone with my insurance provider. And while all of this was a labor of love for my mom, working out the financials of my cancer treatment was also a whole lot of labor, plain and simple. Between the long hours spent taking care of me and dealing with our insurance, my health care became her literal full-time job. She took 2 years off of work to take care of me, a financial and professional sacrifice that was due in part to the incredible amounts of time it required to navigate not just the treatment of my cancer, but the cost of it. Over the years, the out-of-pocket costs associated with my treatment, co-payments, out-of-network charges, the cost of fertility treatments not covered by insurance, the cost of moving to New York City for the transplant, the cost that came after the end of treatment, and the secondary side effects and complications that I had, like graft versus host disease and a thyroid condition and any number of things, have cost me and my family hundreds of thousands of dollars over the years. The financial burden of my cancer did not mean that my parents had to get second jobs or that we had to sell our house, although I know of fellow patients with and without insurance who have had to consider such options. Sick people don't plan on getting sick, and they shouldn't have the added worry that someday insurance coverage may not be there, or that a medical crisis could become a financial emergency as well. But I've seen firsthand in my own experience and through my work and through the stories of fellow patients in the cancer community that access to quality, affordable, coordinated care in the US is still a big problem for patients with and without insurance. And I've seen how patients end up in impossible situations where they have to make decisions between things like life-saving medical treatment and rent and groceries and paying their heating bill. For the first time in a very long time, I've noticed that there are entire days, sometimes maybe even a week, that go by where I don't think about cancer and I don't think about everything that I went through. And I feel healthy and I feel strong. And for the first time in a while, I feel hope when I think about what the future has in store. So I want to thank all of you so much for inviting me to share my story and for coming here today and for the incredible amounts of time and energy you put into making sure that patients, regardless of who they are or how old they may be or what background they're from, have access to that same kind of hope. Thank you.